Hello students, welcome to IURage. In today's lecture, we are going to discuss about the relations of the liver. So let's get started. So there are two types of relations that we can understand regarding the liver. The first one is the peritoneal relations. That means how the peritoneum is attached with the liver, and the second one is the visceral relations. That means what organs are located asides the liver. So first we'll discuss about the peritoneal relations. So most of the area of the liver is actually covered by peritoneum. We already discussed that there are ligaments which is the true ligaments of the peritoneum or true ligaments of the liver, which are actually the peritoneum layers. They are present all over the liver and supports the liver to be in a position. So by that most of the part is already covered by the peritoneum. And the areas which are not covered by the peritoneum are as follows. The first one is the triangular bare area. I have already discussed or mentioned about the bare area, what is a bare area and what are the boundaries of bare area in the previous lecture. You can go and check that out. So triangular bare area which is present on the posterior surface of the liver is actually not covered by peritoneum. That's why it is called as a bare area, which you can see here. This is the triangular bare area. The second one is the groove for inferior vena cava. So this portion, this blue vein is actually the inferior vena cava, and the groove where this inferior vena cava is located is the groove for inferior vena cava, which is again present on the posterior surface of the liver. So the groove is also devoid of peritoneum, because as there is presence of inferior vena cava over it, and the peritoneum is covering the inferior vena cava and not the groove. So that's why groove is devoid of peritoneum. Next one is the fossa for gallbladder, which you can appreciate here. This is the fossa for gallbladder, where gallbladder is located on the inferior surface of the liver. So here the fossa is devoid of peritoneum because gallbladder is present over it, and the peritoneum is covering the gallbladder and not the fossa itself. So that's why fossa is devoid of peritoneum. Next is the area of attachment of lesser omentum. So the area of attachment of lesser omentum is also devoid of peritoneum. The fissure for ligamentum venosum. This is the fissure for ligamentum venosum, which is present on the posterior surface of the liver. So there is presence of the ligamentum venosum, which is a false ligament of the liver. So peritoneum covers the ligamentum venosum and not the fissure where the ligamentum venosum is located or placed. So that fissure is devoid of peritoneum. Then the fissure for ligamentum teres, which is present here on the inferior surface of the liver. So here again ligamentum teres itself is covered with the peritoneum and not the fissure where the ligamentum teres is located. Okay. So these are the points which are related with the peritoneal relations, as most of the liver is covered by peritoneum, but these are some points which are not covered by peritoneum, which is very important and you have to keep this in mind. Moving on, now we'll see the visceral relations of the liver. So first we'll discuss about the anterior surface, the visceral relations of the anterior surface of the liver. So anterior surface is actually the triangular and concave area. As you know that the anteriorly liver appears like a triangular and concave and the relations of the anterior surface. The first one is the xiphoid process, which you can appreciate here in this picture. This is the xiphoid process which is present here, and this is the liver which you can see here. This portion is the liver. So anteriorly the liver is related with this xiphoid process and the anterior abdominal wall and the diaphragm on each side. As you can appreciate here, the blue portion, this is the diaphragm which is present on the each side of the liver, or it is present covering the liver. So the anterior surface of the liver is actually the triangular and concave area, and they are related with the xiphoid process. They are related with the xiphoid process and the diaphragm, and also to the anterior abdominal wall. Okay. So these 3 points you have to keep in mind regarding the anterior visceral relation of the anterior surface of the liver. Moving on, next one is the posterior surface. So in this picture, let's first differentiate between the posterior and inferior surface. So we draw a line here. So this is the posterior surface and this is the inferior surface of the liver. How we differentiated? Because the porta hepatis is present on the inferior surface of the liver. Okay. So the posterior surface is triangular and concavity in the middle for the vertebral column. So the posterior surface of the liver is also triangular in shape, and it has concavity in the middle for the vertebral column, as the vertebral column is present behind that. So you can appreciate here, this is the concavity which is present on the posterior surface for the vertebral column. Okay. This is the concavity, and it is actually a triangular shaped region or surface. The relation of this surface is, first one is bare area. As we know that bare area is present on the posterior surface. So this portion is the bare area of the liver, and the bare area is related with the diaphragm and right suprarenal gland. Diaphragm and right suprarenal gland is present on this bare area of the liver on the posterior surface. Then there is groove for inferior vena cava. So let me erase this so you can appreciate it properly. This is the inferior vena cava. This is the IVC or inferior vena cava, and the groove for inferior vena cava is present on the posterior surface, and as the name suggests, it is a groove for inferior vena cava. So obviously it is related with the vessel inferior vena cava, and it is related particularly with the upper part of the vessel, and the floor of this groove is pierced by the hepatic veins. Okay. The upper groove is related with the upper part of the vessel, and the floor is pierced by the hepatic veins. The next one is the caudate lobe, which you can appreciate here. This is the caudate lobe of the liver, which is present on the posterior surface. This is the caudate lobe, and this caudate lobe is related with the crura of diaphragm, the right inferior phrenic artery, and the celiac trunk. Next one is the fissure for ligamentum venosum. The fissure for ligamentum venosum is also present on the posterior surface. As you can appreciate here, this is the fissure for ligamentum venosum, and as the name suggests, it accommodates ligamentum venosum. That's why it is called as a fissure for ligamentum venosum. And then the posterior surface of the left lobe. So all these were the parts of the right lobe, anatomical division of the right lobe of the liver, and this is the left lobe of the liver. And this is the posterior surface of the left lobe. This is the posterior surface of the left lobe. So this posterior surface of the left lobe has esophageal impression. The posterior surface of the left lobe consists of esophageal impression. That means it is related with the esophagus. Okay. So these are the important points that you have to keep in mind regarding the posterior surface relations of the liver. First one is the bare area. So this is the bare area. This is actually the bare area, which is related with the diaphragm and right suprarenal gland. Then there is groove for inferior vena cava. So this is the groove for inferior vena cava, which is related with the upper part of the vessels. Then the caudate lobe is related with the crura of diaphragm, right inferior phrenic artery and celiac trunk. And then fissure for ligamentum venosum, again important thing or important point, which is present on the posterior surface of the right lobe of the liver, which accommodates ligamentum venosum. And the posterior surface of the left lobe consists of the esophageal impression. That means it is related with the esophagus. Moving on, next one is the superior surface of the liver, which you can appreciate here in this model. The superior surface is actually the quadrilateral in shape. Superior surface of the liver is quadrilateral in shape, unlike the anterior and posterior surface, which are actually triangular in shape. And the superior surface shows concavity in the middle, and this concavity is for the cardiac impression, because above the middle of the superior surface of the liver there is a presence of heart over it. So that's why there is a presence of concavity in the middle for the cardiac impression or for the placement of the heart. So which you can appreciate here. This is the middle concave portion which is present on the superior surface, which accommodates heart, present above to this surface. And it has convexity on each side for diaphragm. As we know that diaphragm is present on the each side of the liver. So on the each side of liver there is the presence of convexity. So here is the convexity and here is the convexity. This convexity is due to the presence of diaphragm. Okay. This is the diaphragm. You can appreciate here clearly that this portion is the diaphragm, and due to the presence of diaphragm there is convexity on each side of liver. Okay, so that was about superior surface, that it is a quadrilateral in shape and it shows concavity in the middle for the cardiac impression. Here is the concavity and convexity on each side for the diaphragm. Moving on, now the inferior surface of the liver. So here is the inferior surface of the liver. This portion is the inferior surface of the liver, and inferior surface is also quadrilateral in shape. So what we have learned, that the anterior and posterior surface of the liver is triangular in shape, and superior and inferior surface of the liver is quadrilateral in shape. And the relations of the inferior surface are: inferior surface of the left lobe is large, concave, and it has gastric impression. So as you can appreciate here, this is the large and concave portion of the inferior surface of the left lobe. As you can appreciate here, the concavity, and this concavity is for the gastric impression, as stomach is related with this area. Regarding the posterior surface of the left lobe, we have learned that here esophageal impression is present, as esophagus is related to the posterior surface of the left lobe of the liver, and stomach is related with the inferior surface of the left lobe of the liver. Next is the fissure for ligamentum teres, which you can appreciate here. This is the fissure for ligamentum teres, and this fissure is related with the ligamentum teres itself. Ligamentum teres. Next one is the quadrate lobe. which you can appreciate here. This is the quadrate lobe of the liver. This is the quadrate lobe, and the quadrate lobe is related with the lesser omentum, the pylorus, and first part of the duodenum. Okay. Then there is fossa for gallbladder. So this is the fossa for gallbladder, which is obviously related with the gallbladder. And then the inferior surface of the right lobe. The inferior surface of the right lobe has three impressions. The first one is the colic impression, which is for the hepatic flexure of the colon. So this portion is actually the colic impression, or here the hepatic flexure of the colon is related with the liver. Then there is renal impression, which is this portion, which is related with the right kidney. And then there is duodenal impression for the second part of the duodenum. So here is the duodenal impression, which is related with the second part of the duodenum. So these are the relations related with the inferior surface of the liver. What are the structure present on the inferior surface? First one is the inferior surface of the left lobe is related with the stomach, which is large and concave area for the gastric impression. Then there is fissure for ligamentum teres, which is related with the ligamentum teres. Then there is quadrate lobe, which is related with the lesser omentum, pylorus, and first part of the duodenum. Then there is fossa for gallbladder, which is related with the gallbladder. And then there is inferior surface of the right lobe, which has three impression. First one is the colic impression for the hepatic flexure of colon. Then there is renal impression for the right kidney, and then there is duodenal impression for the second part of the duodenum. Moving on. Next one is the right surface of the liver. So here you can appreciate here in this picture, there is presence of lung, there is presence of pleura, there is presence of costodiaphragmatic recess, there is presence of diaphragm. This portion is the diaphragm, and the liver is present here. Here is the presence of liver. So we are talking about the right surface of the liver, which is this surface of the liver, and the right surface is actually quadrilateral and also convex in appearance. As we have already discussed, the convexity is because of the presence of diaphragm here, and the relations of this right surface is that the upper 1/3 of the right surface is related with the diaphragm, pleura, and lung, which you can clearly appreciate here in this picture, that the upper portion, that is upper upper 1/3 is related with the diaphragm. This is the diaphragm, pleura, and lung. The middle 1/3 is related with the diaphragm and costodiaphragmatic recess, which you can appreciate here. The middle 1/3, that means this portion is related with the diaphragm. This is the diaphragm, and this is the costodiaphragmatic recess. Costodiaphragmatic recess is actually the potential space in the pleural cavity, which acts as a reserve space for lung expansion during the deep inspiration. If there is deep inspiration, then this space or this potential space in the pleural cavity, it reserves the space for the lung expansion or the expansion of the lung. So this is the costodiaphragmatic recess. Let me erase it so you can appreciate it properly. So the middle 1/3 is related with the diaphragm and costodiaphragmatic recess, and the lower one third is related only with the diaphragm. Okay. So there are three important relations. First one is the upper one third. The upper one third is related with the lung, pleura and diaphragm present here. The middle one third is related with the diaphragm and costodiaphragmatic recess, and the lower one third is related with only the diaphragm. Okay. So that's all for today's lecture. In today's lecture, we have discussed about the relations, peritoneal and visceral relations of the liver. In the next lecture, we'll discuss the next topic related to the liver. Until then, keep reading and don't forget to subscribe, like and share. Thank you for watching this video.